Why does it take so long for ACL grafts to heal? This is one of the most common questions patients have, and to understand this, you need to understand the process of graft healing. Right after surgery, the knee experiences a rush of pro-inflammatory cells in response to the trauma from the surgery. This phase is termed the early healing phase and lasts about 4 weeks after surgery. It is classified by the lack of blood supply to the new graft and the beginning of graft necrosis, a process where the graft begins to actually break down due to a temporary lack of oxygen and nutrients. But despite the graft being in a state of slow decay, the new graft is actually stronger than the original ACL at this point. This inflammatory response is initiated by the body's immune system and is a way to protect against infection and is responsible for the release of growth factors, which set the stage for the healing process to follow. The next phase, known as the proliferation phase, is the most dramatic in terms of the evolution of the new graft. New vessels begin forming in the graft, bringing much needed oxygen and nutrients. And the body begins to remove the debris of dead cells, which includes the necrotic cells of the new graft tissue. Removal of this tissue creates room for healthy living cells to thrive, but this also causes the graft to weaken significantly. This process overlaps a bit with the previous phase, beginning around 3 weeks and lasting up to 6 to 9 months after surgery. During this phase, the graft is weaker than the original ACL, and it is at risk of stretching out or even rupturing. This is the primary reason why activities such as returning to run and sports are delayed, to avoid overstraining the relatively weak ACL graft. If you're enjoying this episode of Physio Show, give it a like to help the video spread to more people. It goes a long way toward helping our channel grow and continue providing you more answers to your rehab-related questions. The final phase is known as the maturation phase. In this phase, the cells of the ACL graft begin to transform into tissues that more closely resembles an actual ligament. This phase begins around 3 months after surgery and continues for over a year after. This is the phase where the graft starts to regain its strength. Now, the speed at which this process occurs varies depending on the type of graft used. For autografts, or grafts from the person's own body, the graft achieves a level of strength equivalent to the original ACL at around the 9-month mark. This is why most research does not suggest returning to sport until after this time. On the other hand, allografts, which involve tissues from a donor, typically regain strength at approximately half the rate, reaching the strength of the original ACL at around 18 months after surgery. So remember, it's not only essential to restore strength for proper knee control, but also to allow for sufficient enough time to pass, allowing the graft to get stronger and tolerate the demands of the intended activities. The primary objectives of physical therapy after ACL reconstruction initially involves restoring range of motion and mitigating swelling and pain. Once these goals are met, the focus then shifts to building strength and enhancing muscle control. While team training and simulated sports drills is allowed approximately 5 to 6 months after surgery, engaging in contact sports is not suggested, again due to the lack of sufficient healing of the ACL graft. A full return to sport is typically allowed between 9 to 12 months, as the ACL should have the same amount of strength as the original ACL by this point. But this is contingent on achieving sufficient muscle strength, control, and overall fitness. In cases of allografts or revision surgeries, a more gradual progression is typically recommended. Well, I hope you enjoyed this episode of Physio Show. Hit that subscribe button so you will be notified when the next episode drops.